Okay, excellent. So, hi Tim, we are live on Facebook. Hopefully this is working because we did have some issues with trying to connect on this, but all looks to be going swimmingly. So, hi to all of those that have joined us for this webinar.
Yeah, well, thanks for joining.
Yeah, thank you. So, I'm going to just share the presentation with you all and we'll kind of go through it, and there's time for questions and things at the end should anyone have them. So, presentation. So our webinar is on knee pain in cyclists, and we'll talk a little bit more as we go through the presentation on how this fits in with what we're doing, because we haven't yet released anything and we realise that this is our inaugural kind of post really. But
a little teaser, little taste.
Little teaser. So let's just click through. So who are we first of all? Well, if you haven't clocked our names already, I'm Bianca, obviously, and my colleague Tim can also be seen on screen. And we're physios really who've got a lot of experience together. I mean, over 30 years experience. And we've worked with, recreational athletes right the way through to aspiring Olympians and Olympians.
International.
Tim also holds a lecturing post. And so his knowledge on biomechanics is excellent. So, yeah. So the module structure really, these are just an example of some of our modules that we've got that will be published at some point. We have some different levels of modules. So some of them are going to fall under some basic introduction level modules. So this one, for example, knee pain in cyclists falls under that. But as we work our way through the different levels, basically things get a little bit more meaty and a little bit more complicated. And there's some advanced clinical reasoning stuff in there as well. But moving on to the nitty gritty. So I'll leave Tim to just go through some of these points with you, and we'll pick up some conversations as we go along. So Tim, are you all right to go through these learning objectives?
Yeah, so in this little talk we're going to do now is just to review a little bit regarding what knee anatomy is and what normal variations in knee anatomy are, and how maybe some of these feature or factor into why a cyclist might be presenting in your clinic with knee pain. And this will just start to feed into some of those possible causes of knee pain. So do you want to move to the next slide?
Yeah, sure.
So when it comes to the reasons why people might develop knee injuries, is appreciating that we are trying to merge this man and machine. So it's that very fixed 2D machine, the bicycle, and a very 3D asymmetric machine, which is the human body. So there's always this debate about how much of it is regarding the bike fit as the driver for any potential injury, in this case knee injury, or is maybe bike fitting not the key factor, and is it other things, even just sort of training loads and training patterns, and is that maybe more of the risk factor? And of course, when we're talking about these knee injuries, these are non-traumatic musculoskeletal injuries that we're talking about. Yep.
Absolutely. There are some links to some research articles there if anyone would like to look at them, but anyone that's on our mailing list will send these out as well. But it's really interesting because the evidence base out there isn't conclusive around bike fitting, and I think a lot of this is because everyone is such an individual and their needs are very much relative to what not only do they want to do, but what their injury history is, etc.
Exactly,
for anyone who is interested, go on, sorry, Tim.
Yeah, which is exactly why we want to try and get across the message that you need to be assessing and reasoning every individual that you're seeing, and you're not following any kind of protocol, because you will find people that don't fit whatever maybe one research paper says, because there is this debate, and it has been proven that in some cases it's going to be this position that causes knee pain, and in another individual it's going to be this. And you need to understand the individual sort of nature of the patient that you're seeing, or the client you're seeing.
Exactly. So moving on.
So exactly, we've got a lot of data regarding incidents of injuries in traumatic cycling injuries, largely driven by people who turn up to A&E following an accident, and cycling has been listed as the cause of how they've ended up with whatever injury that is, whether that is knee pain, a knee injury. But our knowledge of what the incidence is for non-traumatic knee injuries in cyclists isn't quite so clear, mainly because there hasn't been that many research studies done. There's been some looking at questionnaires of people doing big multi-day cycle tours or big sportive type things, a little bit looking at season incidents in pro teams, but again, not very much data. So what papers we have got are listing somewhere between sort of 14-15% through to maybe 33%. Or is maybe we're getting some feedback there. Injury incidents in cyclists per season. But what it is going to be multifactorial. So it's not going to be one thing particularly causing one type of injury. So we need to be looking at the whole person as why they might be getting injured.
Exactly.
So we often think about the knee, and we can simplify it and think about the knee as purely being a lever. And often we think about our knee angle in cycling, so we think about our knee flexion and extension positions, and we're thinking maybe about some of the compression forces, maybe that kind of knee over pedal spindle, knee at the bottom of the pedal stroke, top of the pedal stroke, and what forces might be getting applied there. But one of the messages we want to get across in this little intro video now is the knee is not just a pure hinge joint. There's a lot more to it. So we're just breaking down that knee anatomy and just highlighting a couple of things here. There's that difference between the medial, the inside, and the lateral, the outside part of the knee here. And then showing you onto the x-ray of the knee, or the slice through the knee here, is that serves a purpose. It gives our knee some stability, and particularly when we're looking at the knee cap here, it's giving some stability to the lateral, the outside part of that kneecap. So it stops the kneecap getting pulled too far sideways. So it's appreciating that the knee is asymmetrical, and therefore it is designed to move in more than just a pure hinge joint. So we go to the next slide. It's then appreciating we don't just look at the rider side on, and we also don't just look at the rider front on. We've got appreciating how it's moving in all three dimensions of space, and what one thing might do to another. So we might move something on the saddle, but what's that going to do to the foot and the ankle, and what effect would that then have back up on the knee?
And in the world of bike fitting, some practitioners may only look at people from the side, but actually what we want to promote is looking at people in what we call the XYZ plane. So the Z plane in this case is looking at what is that knee doing in terms of not just the flexion and extension, but all of those other movements that do occur.
And also making sure that we're looking on both sides as well, and comparing that left and right, because we are asymmetrical. So you've got to be appreciating both sides. So even if somebody has had a retool bike fit, and both Bianca and I are advanced retool bike fitters, however, just because somebody's gone through a certain system or a certain sort of theme of bike fitting doesn't necessarily mean that they've had a good bike fit. There's plenty of people I've seen who've had a retool fit, but they've only been looked at on one side of the body and not both sides. So anyway, going off on a slight tangent there. No, sorry, stick back to that last slide there, Bianca.
Yeah. If
you can go back one. So appreciating that the knee does have quite a lot of variation. It's got 6 degrees of movement here. So it's not just that extension and flexion. We've also got a little bit of sliding force. The knee will slide forward and backwards, and it's supposed to do that. It is going to bend inward and outwards, and it's supposed to do that. It is going to rotate. It's supposed to do that. It's even going to slide a little bit, side to side that way, as well as distracting and compressing. So just appreciating that it is supposed to do this. The knee is supposed to rotate, for example. is a key factor to think about when we're doing our bike fitting. We don't want to stop the knee rotating if that is what this particular knee that you are looking at wants to do. So that might come into things regarding, do we want the knees kicking out to the side? Do we want the cleats to have a lot of float or not a lot of float? And the answer to that will vary depending on who you're talking to, who the patient is in front of you. So, yeah, sorry, next slide. So when we're thinking about that flexion, just appreciating here that it is normal to get, during that bending, that flexion of the knee, a rollback of the femur on the tibia there, and we are getting some rotation there. So when we think about taking our measurements, we often try and pick a middle point of the knee joint as our point of rotation. But it is appreciating that actually that pivot point does move forward and backwards depending on what the angle of that knee is. So when we're taking our knee joint angles, it is very much a guesstimation. We're not being that accurate because we're not changing the fulcrum point of that joint angle. So just a point to take into account. So again, as it then goes into extension there, it is going to slide, it is going to roll, and it is going to rotate, and that is normal. That's part of what we call this screw home mechanism.
And what's probably really important to just note with cycling is that there aren't really any other sports that are similar in terms of the biomechanics involved, because think about how many times a cyclist is going to go in and out of flexion, and not only that, but the range that's involved. Can you name another sport where that happens? And this is why the incidence of knee pain and the biomechanics of knees and knee pain in cyclists may well be different to your runners.
So then again, it's looking at some of the kinematics. We're looking at the kneecap here, the patella, and it's appreciating where in certain joint angles that patella takes more of the loading forces. So this might be useful to think about with somebody who has maybe the beginnings of patellofemoral OA, arthritis. So if they've got maybe a little bit of wear and tear on a certain part of their patella, you might decide to put them in a certain position to reduce the frequency of how often they're loading that patella in certain angles, in certain positions. So these are just some of the things that might start to feature into why you might fit outside of the box, as it were, outside of normal ranges, if there is such a thing as normal ranges. So when we're thinking about why would somebody get injured, we do sort of come back to this alignment and symmetry. And although I've said that we are asymmetrical beings, and that needs to be appreciated, is appreciating that maybe excessive asymmetric loading might be a potential cause for some of that injury. And there's going to be lots of reasons why somebody might be loading asymmetrically. Sometimes it's just skill on the bike and actually their technique of pedaling, their training age and experience here. So the way that a young person or somebody who's been riding a lot from a very young age learns to pedal and learns to ride may be different to somebody who's come to cycling much later in life, or has come from a different sport. And what's the like I say, the kind of athletic age of them as a cyclist? You might have somebody in their sort of 40s or 50s, but because of what they've been doing in their earlier life, they're going to move very differently to somebody who's always been cycling on the bike. And you may not want to change it, you just appreciate it and factor that into your bike fit. So what other sports have they done that's taught them certain movement patterns? And again, how does that then need to be fitted into the bike? What type of riding are they doing? Are they somebody that needs to get into a TT position, triathlete or a time trialist, versus a roadie or mountain biker, tourer, something like that? What are the normal asymmetrical anatomical patterns of that particular person? Have they got a leg length discrepancy, is the classic example? Have they got, and we're going to explore this a bit more, is things like some femoral torsion, tibial torsion. So are their bones naturally twisted a little bit? And that's normal. What about anything on the bike? So it could even be that their saddle's a bit twisted or their handlebars are a bit twisted. I've even had a case of somebody bought a bike second hand and the cranks were different lengths and they didn't realise. And then they came in and they were in problems, and we spotted, hold on, whoever you bought this off has put 2 different cranks on and they're different lengths. So you can get weird and wonderful things like that. I've worked with some of the GB track bikes, and you see suddenly that because they've been putting a lot of force going around the track in the same direction, they've actually managed to twist the frame and twist the saddles, and that becomes an issue. What's the kind of training load they're doing? So again, this is looking at training intensity, volume, and is that maybe what's then developing to certain loading issues there? What's their dominance? Are they very left or right-handed, and therefore maybe driving a bit more with one leg through every pedal revolution? All these things are going to feed in, and then that potentially leads to any particular problems.
There was actually a really good systematic review that was done by a plethora of researchers here, and this is accessible as an open access article on the internet, which is quite useful. So some of those things that Tim actually has gone through, they've actually tried to go through the literature and break all that down and find the evidence for it, and actually it's a very comprehensive breakdown of some of the potential causes, and they do acknowledge that there are individual reasons as to why these things may occur. So a useful article to check out.
So I touched on this a second ago, but we have normal, emphasis on that normal variations. And if we're thinking about purely the lower limb here, we can break this down into angular and torsional. So on the angular side, you can have varus or valgus, so either kind of bow-legged or knock-kneed. You can have flexion, so maybe the knees don't fully straighten, or hyperextension, they can over-straighten, almost bend backwards on them. And then we've got our torsional, and within the tibia, so we can have the foot very slightly pointing out, or the foot slightly points inwards, and at the femur, the thigh bone, again, we can have it rotating in or rotating out, and that is normal, and that needs to be appreciated into how you expect somebody to move on the bike, rather than forcing them to move in a so-called sort of textbook manner, because that may not be exactly how their body wants to be. So just putting some images to that one there, you can see we've got a variety of angles at the femoral neck, at that top left there, different lengths of the femoral neck. The bottom image there shows different rotations through the femur, and then the bottom right there showing the pelvis and different angles and directions of where the socket bit, the acetabulum, is sitting and pointing. And whilst these are normal variations, you can even have left and right differences. So if you spot a cyclist and one knee is kicking out to the side and the other one isn't, maybe that's the way the bones want to go. So don't necessarily force them to push it back in and force them to go straight. If they're sitting a little twisted, maybe that's why. So if we look at the hip and we're looking at femoral anteversion and retroversion, you can see that if you try and force the hip to go in a way you think it should go, it's going to force maybe the toes inwards or outwards. So think about what's happening at the cleats here. You may need to have the cleats aligned so the heels are angled right in order to put the hip in a good position, and therefore for the knee and hip to track along the anatomical alignment that the bones want to go and the joints want to go. So that may well be the knee kicking out to the side. So how are you actually going to measure this? Well, the only really accurate way is going to be through a CT scan. But you are not going to be putting all your cyclists through a relatively high dose of radiation to get a CT scan. So it's going to be through your clinical assessment. And we're going to go through this in more detail about how we assess people in clinics to get a feel for where their alignments are like and what you might need to accommodate within their bike fitting. And also, as well as thinking about their rotational alignments, it's also thinking about the ratio of how the body's put together. Are they long body and short legs, or have they got long legs and a short body? What's the femur versus the tibia ratio? So again, in cycling, we talk a lot about maybe knee over pedal spindle or knee over the pedal position. But of course, the length of that femur is going to influence that, and what effect that then has at the hip. If somebody's got a very long femur, you're going to be pushing that hip right back, which is going to close that hip angle down. That may not be what you want to do. So really what we're trying to get across is with this slide here is that there are lots of potential reasons why somebody might get injured. And we can try and make it really, really complicated. And you do need to maybe try and appreciate all the different factors here, but keep it simple. So we can tie it down to usually a couple of simple things. I'm going to turn the slide again. So the things are going to be misalignment, whether that's bike not lined up, body not lined up, something's not quite in the right position. So we're looking at doing some form of bike fitting to address whatever that alignment might be. And the other really key thing is simply training error. Most non-traumatic injuries have some form of training load error at their root cause. So sometimes people might not be aligned in the textbook way, but they don't get injured. They're fine because they've gradually built up that training load. So often it's a case of maybe tweaking the bike fit and then educating them on appropriate training load. So when it comes to the bike fit, we can then break it down to a couple of simple things here. It's going to be up at the hips and the pelvis is what's that saddle height? What's that saddle forward and aft position? And is the saddle allowing them to put their hips and their pelvis in the optimal position for them? Taking it down to the other end of the foot, is the foot being supported in a stable manner? Is the cleat position putting the foot, therefore knee and hip, in the optimal alignment for them? And then maybe what's happening further out at the front end? So where are they putting their hands? And what effect is that then having on where they want to sit and where they're then positioning their whole body over the bike?
Precisely, Tim. And what's really interesting is a lot of the topics we'll cover in more detail as we create some and release some more of the content. But for saddle height, for example, one of the potential reasons why someone may get knee pain may actually be linked to the knee adduction that occurs with the saddle height, not actually the amount of flexion they're in. So that's something to think about. And the same with saddle fore and aft. There's actually been a recent study that looked at the saddle fore and aft position, and they found that there were no differences in tibiofemoral forces and stresses that occurred regardless of the fore aft of the saddle, which kind of debunks some previous research which actually says a further back position causes increased pressure and increased forces through the tibiofemoral joint. So we're uncovering things that perhaps in the bike fitting world were taught to be correct and may not be correct. And the reasons for this may be, again, multifactorial. It will depend on tissue length. It will depend on whether they're quad dominant, whether they're posterior sling dominant. And just to pass on with what Tim was saying as well, you do find probably if someone's saddle is forward, although the tibiofemoral forces may be reduced, you may find that actually they're bracing through their quadriceps to push themselves back onto the bike and stabilize. So sometimes, you know, just thinking outside the box is what you've got to do with these clients. So really, to summarise, as Tim's kind of said so far, knee pain in cyclists is wholly multifactorial, and it's really important to reason what's going on and why that presentation is occurring in that cyclist. So the easiest thing for you to do as a practitioner is exclude the obvious. Is it actually that there is some inherent muscle tightness? Is it that they're really weak? Address those issues, look at load, because all of these things are in your remit. If you're not really confident at the whole bike fitting thing, that's something that, as I say, we'll discuss in more detail as we go through some of these modules. But, you know, developing some knowledge around this area is really going to help you as a practitioner as well, particularly if you're not someone who wants to necessarily get into bike fitting in a formal manner and you just want to have a bit more of an understanding around how to deal with these injured cyclists, because so many physiotherapists that I work with really don't understand cycling and don't feel confident treating cyclists, but actually there's a lot that you can do. So with some of those references, if any of you are on the mailing list, we've got your details and I will send those through. So if you're not on the mailing list, it might be worth just adding your email to it, which can be done via our website. And we've also got some social media channels, so we'd love it if you'd reach out to us on those. and let us know what you think of our first webinar, really.
And if you've got some particular questions or key topics you want us to try and cover, then we'll put together some little mini content or little webinars that we can then help you out with, along with our key modules and key information we want to get across to you.
If anyone has any questions, we are open for questions. We're just trying to work out how to use this, but I am on the comment section, so I should be able to see anything that you guys post up. Thanks, Brian, for the comment. That's good, because I know comments are working there. That's good. Does anyone have any questions around knee pain and cycling? It appears not. That's good, because it is Sunday, and we did say we want to enjoy our dinner. And Tim's on holiday, so I think we will leave it at that then. Thanks for listening, guys.
Cheers. See you soon.